Hey guys, welcome back to the channel. If you haven't been here before, my name is Chad Boney. I'm glad you made it to my channel. Today, I hope that this information will be helpful for you. Possibly this could be the one-stop shop for you for Mounjaro needs. I am here to give you my advice. I am not a doctor, disclaimer. This is just thoroughly my advice, my own personal opinion. But I'm going to give you some research and some reviews and my own personal history with Mounjaro, how it's affected me, side effects that I've dealt with. But I will get into that in another video. And some of the videos, I've already done that. But this video is for side effects. A lot of people have asked me in comments throughout some of my videos about certain different side effects. So today I thought it might be helpful for me just to break it all out. I've already done the research myself, so you don't have to score through all of the internet to find this stuff. You can find it right here. So I'm just gonna go over the list. It's gonna be a short video, but I'm just gonna go over a list of more common side effects and less common side effects. So if you are dealing with side effects of any sort of these, know that you are not alone, and this is part of the Tirzepatide. All right, I'll get right into it right after this intro. All right, guys, I'm going to go real quick through this list of side effects, and hopefully it will help you. So what are the serious side effects of Mounjaro? I'm just, like I said, I'm going to go through this list. I have them written down, so excuse me for not looking right at the video camera. But the more common side effects is going to be stomach pain. So I'm sure that you have at some point, whether you're on the 2.5 where you start milligrams, or if you're on the very top where I'm at, 15 milligrams, you will or you have experienced some degree of stomach pain. And if you haven't, man, God bless you. You are doing great, and you are a very rare type. So anyways, stomach pain. Less common, guys. Difficulty in breathing or swallowing. Fast heartbeat. I had somebody the other day ask, I think it was last night, if the rapid heartbeat was something that was common. And I hadn't heard a whole lot of people talk about fast heart rate, heartbeats and stuff like that, but it is a less common side effect. Gaseous stomach pain, as we already talked. Heartburn. Have you guys experienced any heartburn? Unfortunately, I haven't had a whole lot of heartburn. Recurrent fever. That's another one that I've never experienced, but maybe you have. Skin itching, rash, or redness. Another one I haven't ever dealt with myself. Stomach fullness, guys. Absolutely. I can attest to that. I'm always full. Hardly ever want to eat. My wife will ask me, hey, where do you want to go eat at? And I'm like, I don't care. You pick, because I'm really not that hungry. If you can relate to that, guys, go ahead and drop a comment below. Let me know. Swelling of the face, throat, or tongue. Haven't had any of that. In fact, with the Mounjaro, I've had less swelling because, I'm just losing some fat. And so maybe you can relate to that too. Vomiting. Haven't had a lot of vomiting. I will say that when I was on Victoza before, I did have vomiting. I'd wake up in the morning. If I ate too much like carbs and too much high fat foods, I'd wake up in the morning and I'd feel just so sick, like I ate eggs or something the night before, and I just would throw up. And after I threw up, I felt so much better. Maybe this is something that you've been affected on Mounjaro as well. I have not, fortunately, with Mounjaro, but like I said, Victoza I did. Ozempic, I never had that issue. Ozempic really I only took it for about a month, but it did absolutely nothing for me. No side effects in good ways or bad ways. But that's another video. Yellow eyes or skin. Never had that. I would imagine it'd be kind of like a jaundice type look. Have not had this. Again, guys, this is less common side effects. More common side effects would be like acid or sour stomach, Belching, guys, I did do a short video on that because I don't know about you guys, but I have had times where I would belch and man, it would clear the room out, guys. It would want to clear me out and I couldn't even leave. Please excuse my puppies. They're in the background and there's nothing I can do about them. So, you know, they're 13 weeks old, so they're just puppies. So disregard them. Belching. How many can relate to a nasty belch? You know, it's like, did somebody pass gas? No, I just belched. I just, you know, people joke around. I farted out of my mouth. It's totally disgusting, guys. Constipation. That's another one that I did do a review on. I actually did a video on a common side effect with constipation and how I treated that. I don't have a lot of issues anymore with constipation as of right now. I'm almost 2 months into the 15 milligrams. I think eventually your body kind of gets used to the medication. So, but go ahead and I will advise you to go check out that video. It is on my channel, and it's side effects to Mounjaro. Stomach discomfort, excuse me, and upset, which we already talked about. Anxiety, bloating, blurred vision, change in vision, chest tightness. These are some less common side effects, but these could be side effects to Tirzepatide, Mounjaro. We got chills, cold sweats, coma. My gosh, I hope nobody goes into a coma. Confusion, constipation, as we already talked about. Cool, pale skin, cough, darkened urine, depression, dizziness, fast heartbeat. Going back to that again, somebody had mentioned last night they had rapid, fast heartbeat. Listen, guys, this is a side effect of Mounjaro, of Tirzepatide. It's a less common side effect, but it is. And, you know, from what I've read and researched, a lot of these common side effects will go away if you stop taking the medication. So it's not something you have to worry about like long term. It's affecting and changing your chemistry and causing problems long term. We've got dizziness, as I said, fast heartbeat, fever, increased hunger. That's an interesting one because I have not really had that side effect. That should be a very, very less common side effect to Tirzepatide because it's supposed to decrease your appetite. Now, my appetite, as I referenced in my review of 15 milligrams on my channel as well, about a month or two ago, I never seen the benefit of the Mounjaro, the Tirzepatide, of weakening my hunger and just kind of causing me to be full until I got to about, I would say probably somewhere between 10 milligrams and 15 milligrams. 10 to 12.5 is where I started really feeling the difference. But I will say your A1C, it'll take anywhere from 8 to 12 weeks to start seeing that target range. You will automatically start seeing a big difference immediately in your blood glucose level. So when does Tirzepatide or Mounjaro start working? Immediately. It will start immediately, guys. But as I said, you will not see a big difference in your A1C until about 8 to 12 weeks later. Indigestion. Large hive-like swelling on the face, eyelids, lips, tongue, throat, hands, legs, feet, or sex organs. Loss of appetite. That's a most common one that I've seen. I don't know why this one is actually on the less common side effects, but guys, if you can relate to having less hunger, go ahead and drop a comment below. Nervousness, nausea. Those are some ones that I could see happening. I see a lot of people deal with the nausea. And nightmares. Another less common: bleeding, blistering, burning, coldness, discoloration of skin, feelings of pressure, hives, infection, inflammation, itching, lumps, numbness, pain, rash, redness, scarring, soreness, stinging, swelling, tenderness, tingling, ulceration, or warmth at the injection site. Guys, as I said, these are just side effects that are common, more common and less common with Tirzepatide, which is also known as the Mounjaro by the brand name. But anyways, guys, I just wanted to go through these today. And so that way, if you're having any side effects, you can come back to this video and reference this as side effects and say, you know, that is one of the side effects I have. So I don't have to necessarily worry. I'm not saying that your side effects is just straight from Tirzepatide, but if you started taking this medication and you're starting to see these side effects, it's a pretty good chance it is coming from this medication. So with that said, guys, thank you so much for checking out the video. As I said in the beginning, if you're new here, if you haven't subscribed to the channel, please do. It'll help me with growth of this channel. And go ahead and like this video, because the more likes it gets, the more people in the algorithm it'll show. Go ahead and hit the notification bell, so that way every time I come up with a video that is helpful for you, it'll automatically pop up and you will be notified. So guys, thank you so much again. You have a great day. God bless you, and I'll catch you on the next video.